now. Okay. I'm Lance Christensen. This is my uncle Lance McAdams. I'm gonna let him introduce himself. Just one kind of question: what was your path like to the medical field? Your career path?
I'm Lance McAdams. My career path to into medicine. As a kid, I liked animals. I thought I wanted to be a veterinarian. As I got older, I decided I'd rather help people. I went to Brigham Young University for undergrad. I majored in international politics. I then went and did a combined master's degree with the Fletcher School of Law and Diplomacy at Tufts University with the medical school program. So I graduated from Tufts in 2006. In order to pay for medical school, I entered the Air Force Health Profession Scholarship Program. So they paid most of my medical school. I then had to do residency with the Air Force. I did family medicine. I was out at Travis Air Force Base in Northern California. And then after residency, I had to pay back 4 years of additional active duty service. So I went to Korea, a base called Kunsan. Was there for a year, and then the last 3 years of my commitment, I was at a NATO base in Germany called Geilenkirchen.
All
After
right.
getting out of the Air Force, after getting out of the Air Force, then I started doing locum tenens, which is kind of traveling doctor. I started doing urgent care and emergency medicine. So eventually, I did an emergency medicine fellowship in Arkansas, and I pretty much only work in emergency medicine now, usually in smaller rural facilities.
Okay. Thank you for that. What made you want to become a doctor?
Yeah, I liked animals. I liked biology. I liked science. And that's all interesting. And then, it's a profession that, honestly, I mean, it pays well. It's a respectable profession. You get to help people. Um, and I don't know if I was good at anything else. So,
Stick with what you know.
mhm.
Stick with what you're good at. All right. So now time kind of to the topic. You've been in like the medical field for a while now. How have you seen the corporatization of medicine grow in the time that you've been a doctor? So by that I mean like big business owning previously privatized medical practices, like insurance companies kind of affecting doctors. Like how have you seen that grow in the time that you've been a doctor?
So I can't say that I've as much been directly affected by it because working in the Air Force, that's the military side of things. It's a very different system than the private system, civilian world, I guess. And then doing locum tenens, which is the traveling physician uh, kind of working. Um, I haven't really actually had to be in a private practice and deal with some of it. I'm more of a contractor. But I mean, I know I've seen enough and been around enough people to know that it is happening. Um, one of my ex-girlfriends is an optometrist, and just within the last, it's probably only 3 or 4 years ago, the practice that she was working with, they had ophthalmologists, and then she was an optometrist with them. They were bought out by a private equity firm, and I saw just you know, the way um, they try to streamline things, but it often though it doesn't help the providers, your doctors and your optometrists and whoever else. It doesn't really make it easy for them to take care of patients. They say they're trying to get rid of redundancy, in administration, but they'll oftentimes get rid of an experienced person who maybe they have to pay more um, in order to put someone else in for the same job. So, for instance, this practice, this optometry practice, they had someone who was a coder there who had lots and lots of experience. It was really good at her job, and they got rid of her. Unfortunately, coding is maybe the most important part of medicine. You put down codes for the services you render, and that's how you get paid. And it's this whole very labyrinthine system. It takes a lot of just sort of experience and knowledge through experience to, kind of know the ins and outs of it, um, in order to do it well. And if you don't code well, you can lose out on a lot of money for your practice.
Right.
So they try to cut back on, experienced people like that. And that's a real problem. What else have I seen? I've talked to a lot of doctors who uh, would work for a corporation. A lot of times the hospital is the corporation. And what they're doing, and especially in a lot of small towns, but elsewhere, they will buy up all the private practices, which are usually primary care, your family doctors, pediatricians, internal medicine doctors. They'll buy up those practices, um, and then those practices, they become part of the hospital system. The unfortunate reality is that primary care doesn't pay nearly as well as specialty services. There's a I don't know all the ins and outs of it, but there's the CMS, it's called the CMS. It's kind of a group of physicians who help to set reimbursements for different medical services, and it's something like 30 representatives of different specialties. But of those 30, there's only three of them that are in primary care: pediatrics, internal medicine, and family medicine. And yet those physicians make up close to 50% of all the physicians out there. So they're vastly underrepresented. And of course, your specialists are going to then, vote for or lobby
Make
or
decisions based on
try to
what they
make
want.
decisions, that help them out, give them better pay. The reality too is that procedures, if you can do a procedure, you can usually bill more. So, whether it's cardiologists doing echocardiograms or which are ultrasounds of the heart, orthopedists and surgeons, during surgery, those things uh, pay a lot more. Even things like anesthesiologists doing, different kinds of injections and things like that. Those sort of things pay more, and they may be fairly simple procedures to do. They may not take a lot of time. Whereas in primary care, you're taking care of, all kinds of different issues. A lot of times it takes a lot of time to uh, figure out what's going on with someone and to come up with a plan and then explain that plan to them. And the reimbursements aren't adequately I don't representative of the amount of time that it takes to do those things. But the hospital systems, they want to then filter all of these patients though into their specialty clinics. And so primary care then becomes this almost triage system where they're paid less, they're just seeing tons of patients. Doctors in a lot of places maybe have 8 to 10, 12 minutes to see a patient and make a decision and come up with a plan and make decisions. They don't have time to really take care of things. There's lots of things that family doctors could do that are trained to do procedure wise and things like that, but they don't have the time. And so they refer those things out to the specialist to take care of. And that's often where the hospital systems make their money, is with the specialist care.
Hmm.
The other thing too is with private equity, a lot of times they're buying up practices and then they're trying to make them profitable, whether that's cutting staff, boosting numbers, whether it's cutting pay, um, and in such a way then they increase the um, what they can report as the revenue for the practice, and then they sell it on to the next person, right? And so uh, that's a big problem as well. A thing about medicine, there's all kinds of problems with our system, but one thing about medicine is that it's not a normal commercial industry. I mean, usually, whether it's restaurant or, whatever it is, the customer's always right. It's a bit of a cliche, but there's that idea that the customer's always right. But oftentimes in medicine, the customer is very wrong, right?
Hmm.
Oftentimes they think that something's wrong and that's not the problem, or they think they need this treatment and that's not the treatment they need. And in fact, there could be real harms associated with those treatments. So it doesn't work like a normal market system, you know? I mean, there's plenty of patients who come in and say they need, um, they need Percocet, they need opioid painkillers, for everything. And those medicines have real risks and, and real limitations in what they can actually do and treat. And so uh, there's a, it's a, there is an element of paternalism as, a doctor in treating people. It's taking the information, you're working with them, but it's also you're you need to do for them what's best for them, not what they want or think they need.
Yeah,
And so that it doesn't really fit into kind of a normal market system that way.
yeah. In my research in like private equity and insurance companies owning practices, it's like I feel like it's a big conflict of interest because those companies are purely profit driven, whereas like the whole like point of like doctors in the medical field is to help people, whereas like help people in the best way possible. But when you're working for profits, then are like doctors incentivized by like the hospital to give them certain drugs that cost more and like you were saying maybe like do procedures that necessarily don't need to be done that cost more money.
Right. Those
That
things can
happens.
happen for sure. Well, and that's kind of the hospital's trying to funnel people into the specialists. I mean, even
Yeah.
for instance, plenty of family doctors can take care of lots of skin conditions. They just don't have time, right? But that visit for a family doctor to even do like a skin biopsy, cut out a sore or a lesion or whatever in the skin, they may have 20 minutes to try to, do that, which often takes more time. And they can bill, kind of for a regular visit. Send that person to a dermatologist, they have an hour, they, can bill significantly more for doing the same thing just because it's a dermatologist.
Hmm.
So, and yeah, I mean, ideally, the medical system would work where doctors, are just there to take care of patients, but the doctors have a lot of blame on, to take on themselves as well. There's a lot of doctors who, are really into making a lot of money, and they've kind of also, though, played into the system. They started practices and then they'll sell them, um, to private equity for the big payout, and so doctors aren't to blame either, or sorry, aren't have some blame as well. But the real money in medicine though isn't doctors, and I'm not complaining. Doctors make good money compared to uh, almost anyone else, right?
Mhm.
But the big money in medicine is in pharmaceuticals, device manufacturing, and in the insurance industry. And we mentioned, just texting with you though, this United Healthcare CEO who was recently killed. I don't know what his salary is, but I've heard that some of them make, tens of millions of dollars a year as the CEO of a healthcare insurance company, which seems it seems a bit obscene to say the least. When
Yeah.
people are have claims being denied and the frustration of that when medical debt is the leading cause of bankruptcy in the country, that person is making, I've heard upwards, and the guy could be wrong, but 20, $30 million a year, you know, $5, $10 million is still a lot of money, another 25 or $30 million would cover a lot of people's claims, not to
Mhm.
mention, whatever other executives are there and things like that. So
Yeah.
this is a
I mean,
timely this assassination of this CE, I think
it's like
health
United
CEO. It's
Healthcare CEO.
interesting. It's
Yeah.
interesting. I think it's going to raise some conversation.
I mean, the bullets like had the words deny, defend, depose on them. You saw that, like the book.
Hmm. Hmm.
That's so, I mean, it was because of insurance. It wasn't like someone just assassinated a guy, like a rich
Right.
dude.
Right.
Yeah.
Right.
Yeah. Um, do you think there are any positives to the corporatization of healthcare? like maybe like streamlined healthcare or like
Yeah, that's what they
worldwide
claim.
systems.
That's what they claim is going to happen, but it doesn't actually end up happening. They say that, like I was saying before, they're going to get rid of redundancy, and a big issue with medicine, with a lot of our institutions, whether it's education now, you know, uh, medicine, education, others, right, is just the growth of the bureaucracy in all of these organizations, right? And medicine certainly, the number of administrators in your hospitals has grown much faster than the number of actual people providing healthcare, doctors, nurses, medical assistants, or other administrators who are directly trying to help those people, social workers and things like that. Um, and I can, just I work in these hospitals, and I often wonder what the value that a lot of these people are providing is.
Yeah,
There's
how many
plenty
like
of planners,
administrators can you
coordinators, or
have?
whatever. I mean, and it's not just medicine; it's lots of organizations. There's just a lot of bureaucratic bloat. Have they streamlined things? I don't think so. They haven't made things cheaper. Healthcare costs keep going up. That they claim that this is going to happen, but their goal isn't to lower overall healthcare costs. Their goal with these corporations or these venture capital or whatever groups is to maximize their investor profits. So they're going to continue to try to charge as much as they can for services provided and pay their providers as little as they can, right? And that's for something like healthcare. That seems to be pretty twisted incentives.
Yeah,
Healthcare costs, though, have continued to go up. So no, I can't. I don't think there's any good evidence that the claims they're making about streamlining and cutting costs, they may cut costs, but they're not passing that on to healthcare consumers or the government, really, whose government is the biggest, payer for healthcare services. It's not our healthcare costs aren't going down, and the rate of healthcare costs is far outpacing inflation.
yeah. So basically, these like venture capitalists and hedge or not hedge funds or yeah, and insurance companies are like making both doctors and patients like suffer. They're raising costs. They're making it harder to like, or at least like the pediatricians and like you said, that first tier of doctors, they're making their lives harder.
They don't help. They certainly don't
Yeah,
help. Yeah. Um, yeah, their goal isn't patient care. Their number one priority. It's maximizing profits for shareholders, or like I said, maximizing revenue uh, to increase the value of that of the healthcare system that they're running, so that they can sell it on to the next person.
yeah. That's basically what I wrote my essay about. That it's just like it takes away from the main focus of healthcare, which is to help people, and it's just kind of like the capitalist country that we live in now, or like I guess that we've always lived in. It's all about big business.
Well, I mean, you know, you do need, uh, there. I don't know. I'm trying to think how to say this. It's what am I trying to say here? It does cost money, right? To it costs money, right? I mean,
Yeah,
you have to pay, especially hospitals and emergency rooms. They're like the fire department. They have to be available all the time, right? You hope you don't need them, but you have to have pay a minimal amount to keep them going. So it does cost money, and so you do need people who can navigate that. Doctors, can be notoriously bad with money. They don't always make the best CEOs and things like that. So there are, roles to play. Um, but yeah, I guess what I'm trying to say, I'm trying to think. I had a thought and I kind of lost it there for a second. But um, it's our medical system is not a normal market. That said, I mean, there could be market forces and market principles that could be applied, to the medical field. in certain ways and in instances, but they're not, right? I mean, there's been a push to have prices listed up front, and it's just a standard list of prices for different services. But
Mm.
hospitals and insurance companies, don't, in a lot of ways, they don't want that. There's an article called, I think it's called Bitter Pill. It's an older article in Time, and then the guy wrote a book about it, but he talks about how hospitals bill for things. And it's this master list they use. And it's got all these, just it's hard to get a hold of. But then when you do, that's where you find out what the hospital charges for different things. But what the hospital says it charges for different things often isn't what the insurance company pays for them. There's just a lot of wheeling and dealing. And then, when there's a lot of complexity and kind of murkiness and how all those things work, there's always opportunities for, to skim, you know, to skim money one way or another,
Yeah.
And and so sometimes, the all the regulation, all the complexity isn't a bug, it's actually, a desired feature that some of these actors want in order for them to, like I said, to find ways to, you know, take pieces, take money here and there.
Yeah.
So some more better transparency would probably be helpful in some ways, but it still goes back to this idea that it's not medicine doesn't work. It's in some ways, it's more of a public good in some ways than it really is a market. It's more like
Yeah.
the fire department than it is, like a normal market, like going to the grocery store or, shopping on Amazon or whatever.
Yeah. I guess that kind of leads me to my next question or my final question. Like, because obviously, like medicine is still, it's like a business and a public good. You still have to like pay people, and there still has to be
Right.
some like people that know how to work with money in it. So,
Sure.
what would you say are like compromises and solutions to the problem? Like the problem that you've been explaining, like how there's all this like shady stuff going on, and it's a lot of it's for profit when it could be cheaper.
Right. Yeah, it's tough, right? I mean, you when you try to impose, regulation on anything, there's always unintended consequences. Do you cap what CEOs can make, the hospital system? I think a big part would be to get rid of a lot of the bureaucracy. Um, these are, it's unfortunate, right? Because I've worked in a lot of small places. Oftentimes, the hospitalist is the single biggest employer by far in a lot of these places. Small towns in Montana, certainly up in Alaska. Um, some of these places, the hospital is the center of everything there. And in some ways, they're kind of it's a way, like especially on the Indian reservations, it's kind of in a lot of ways kind of a jobs program as much as actually providing medical care. Um, I don't know. It's a huge problem, and there's so many interests, vested interests. But I think cutting down bureaucracy would be one thing. Um, I don't know. Do you potentially limit, what a CEO of a medical system can make? You want the best people, but I don't know. I think there's plenty of people who, could do that job and would be willing to do it for far less. I think a real issue is the insurance and pharmaceutical companies. I think that those are, there needs to be profit motive, certainly for pharmaceuticals, but um, there's so much corruption, the way that they perform studies and report data are misleading, um,
Mm.
if not outright fraudulent many times. There's, data hacking, replication crisis. These are, things that are, kind of in a lot of the zeitgeist here. People are talking about a lot. Um, yeah, I don't know what you do with the insurance companies. I mean, if you have universal health care and the government pays for everything, there's also lots of avenues for fraud, waste, and abuse. but it's hard to say that that fully taxpayer funded healthcare would necessarily be that much worse than what's going on now, where you've got these private insurance companies that are really mostly, I mean, huge amount of their, in one way or another, huge amount of their revenue comes from the taxpayers, right?
Yeah.
Whether it's employer tax breaks or people buying, it's mostly government fund. It's significantly government funded in one way or another, and they're taking taxpayer dollars, but they're claiming they're private, and they're really not. So I don't know. I don't know that just getting rid of them you know, wouldn't be better.
Yeah.
Um,
It was hard for
there's
me to find solutions too.
well, and
Like,
there's some of these
there's not a whole lot.
they call it health sharing programs. Have you heard of these?
No.
The one that I know of is called, I think it's called Crowd Health. There's other ones that are more religious, but religious based, church based, but what you do is they're much cheaper. You kind of pay into a general fund, and then you can kind of donate your premiums, to people. Say I had this expense, um, and you can kind of donate that. And then when you need help, then you can, request money for it. And a lot of times with these, at least what I've heard, the CEO of Crowd Health say is, they can pay cash. And so they'll often negotiate down prices, they'll pay cash and they'll pay quick, right? Insurance companies are a lot of haggling, there's all these other issues. Um, they'll pay cash, they'll pay quick, and hospitals and doctors would rather get the money, right away, even if it's less. A lot of times there's just inflation because you're going to have to wait, you know that they're going to, give you a bunch of, headaches about, did you do this or that? And so there may be ways to get around the big insurance companies.
Hmm. Yeah. Well, um, that's all the questions I have. Thank you for doing that. I didn't find anything about like the structural issue of pediatricians sending patients to specialists. Like I didn't know about that at all, which sounds like it's a big part of,
Yeah, I mean, the thing with pediatricians is most of the kids are fairly healthy, right?
yeah.
They haven't
Or
had time
like
to
just like
develop.
your standard
But just in
physician.
general, though, a lot of primary care in general
Yeah.
is, they don't get a lot of time, um, and it's basically a feeder system for the specialists. Yeah,
Hmm. Yeah. Yeah, I didn't know about that. That's interesting. But yeah, thanks for doing this for me.
problem.
Yeah, thanks, Lance.
Okay, talk to you
See you
later.
later.
Bye, bye.